Good morning. So welcome to Module 2 in medical terminology, which is disease and treatment. We define disease as any alteration from the normal body structure or function of any of our body part. Okay. Diseases can be grouped into a number of different categories, but most of the diseases overlap. Okay. So they can be classified into one group, but also classified into another group. Classification of diseases are the following. First, we have the infectious diseases. These diseases are caused by microorganisms and other parasites that live at the expense of another organism or the host. In relation with infectious diseases, these microorganisms that cause diseases are often called pathogen. Patho meaning disease, gen meaning origin. Um, then the next classification is degenerative diseases. So this kind of diseases results from the wear and tear. This results from aging, okay? Okay, or trauma that results into lesions or perhaps necrosis of tissues. And the other one is neoplasia. Neoplasia is the abnormal and uncontrolled growth of tissue. Or basically, when we say neoplasia, it's neo meaning new and then plasia meaning growth. So new growth. Okay. Next, we have the immune disorders. So failures of the immune system, allergies, and autoimmune diseases, okay, which make the body makes its own antibody destroy its own tissue, okay, fall into this category. Okay, and uh, we call the we call that autoimmune diseases. Then we have the metabolic disorders. Okay, this results from the lack of enzymes or other factors needed for cellular functions. Okay, many of these metabolic disorders are hereditary, meaning they can be passed uh, from the family. Okay, then okay, malnutrition caused by inadequate intake of nutrients and the inability of the body to absorb certain nutrients and minerals also upsets the metabolism. Okay, and this would lead to the different metabolic disorders. Okay, next, we have the hormonal disorders, okay, caused by the underproduction or overproduction of hormones, or the inability of the hormones to function properly. Okay? So one example of this is diabetes mellitus. And another one is hyperthyroidism. Okay? There is an overproduction of the thyroid stimulating hormone, the TSH. Okay? Then we also have the mental and emotional disorders. So these disorders affect the mind and adaptation of the individual to his or her environment, such as anxiety and depression. Okay. Etiology, when we say etiology, it means it is the cause of the disease. Etiology. Okay? the cause of the disease, or the origin of the disease. Okay. Next, also in when describing diseases, we also what we call the acute and chronic. Okay. An acute disease is sudden and severe, but of short duration. Again, acute, sudden, severe, short duration. Okay. Next is chronic disease. Long duration progresses slowly. Okay. Long duration progresses slowly. Chronic disease. Okay. For an example, we say uh, acute headache. So that means the the occurrence of headache is sudden, but it is very painful, severe. However, it only lasted for a short time. Let's say for 3 hours. Okay? While chronic, when we say chronic headache, so the person is or have had been experiencing headache for let's say a week or a month. Okay? So that differentiates acute from chronic. As we said earlier, infectious diseases are caused by microorganisms. And these microorganisms are viruses, bacteria, fungi, protozoa, and helminths or worms. Okay? They can also be described according to the dyes or the color they take up when they are stained in the laboratory. So we call that gram staining. Okay? As you can see in the image, okay, Diplococcus is is color red, and that means it is gram negative. Okay. On the other hand, okay, Streptococcus or the Streptococci having the shade or dye of purple or blue, meaning that it is a gram positive bacteria. Okay. In the table shown, these are the common infectious organisms. Okay. So we have the bacteria. The singular is bacterium. So they are simple microscopic organisms that can be found throughout the world, even in our own skin, which some of them produces disease. Okay, we have the next we have the word cocci. Okay, singular is coccus. Okay, cocci are round bacteria. Okay, and some of these cocci causes pneumonia, rheumatic fever, food poisoning, septicemia, urinary tract infection, and gonorrhea. Okay. Then we have the bacilli, bacillus for singular. Okay, they are rod-shaped bacteria. Okay, rod-shaped bacilli. Okay, some of these bacteria causes typhoid, dysentery, salmonellosis, tuberculosis, botulism, and tetanus. Okay, then we have the vibriois. Okay, they are curved rods. Okay, causes cholera and gastroenteritis. Then we have the spirochetes. Okay, these spirochetes are uh, likened to the shape of a corkscrew bacteria. Okay, that moves in a spiral motion or twisting motion. The spirochetes causes Lyme disease, syphilis, and Vincent disease. Okay, then we have the chlamydia. Okay, organisms smaller than bacteria like viruses. However, uh, they are susceptible to antibiotics. Viruses are not susceptible to antibiotics but to uh, antivirals. Okay? So, chlamydia causes conjunctivitis, trachoma, pelvic inflammatory disease, and other sexually transmitted infections. Then we have the rickettsia. Rickettsia similar to chlamydia in growth. Okay? Causes typhus or typhus and Rocky Mountain spotted fever. It responds to diseases. Okay. When cells are injured, they release chemicals that allow blood, cells, and fluids to move into the tissue. And this response is called inflammation. Inflammation have the suffix form of itis. And there are four cardinal signs of inflammation. So the four cardinal signs of inflammation are tumor, dolor, calor, and rubor. Tumor means swelling, dolor means pain, calor means heat, rubor means redness. So the presence of these four signs, okay, indicates that there is an inflammation. So now we go to neoplasia. So neoplasia, we have what we call benign and malignant. When we say benign, so it does not spread or metastasize to other tissues. And it is not fatal or dangerous. On the other hand, when we say malignant, it is a neoplasm that metastasizes to other tissues and is commonly called cancer. And it is deadly and dangerous. Okay? Carcinoma is a malignant tumor that involves the epithelial tissue. So, when we say uh, cancer of the epithelial tissue, so it means carcinoma. On the other hand, sarcoma are cancers of the connective tissue, muscles, or bones. That is called sarcoma. Now, the following are the key terms. We have acute, which we discussed earlier, benign, carcinoma, chronic. Okay. Now we have cyst. Cyst is a filled sac or pouch that is usually abnormal. Okay. So cyst is used as a root, meaning a normal bladder or sac, such as the urinary bladder or the gallbladder. Okay, the root is cyst. The combining form is cysto or cysti. Okay. Next, etiology. Okay, cause of disease. Gram stain is the process of staining bacteria, okay, dividing it into two groups, the gram positive and gram negative. Then we have hernia. Okay, hernia is a protrusion of an organ to an abnormal opening or a rupture. Okay, so inflammation. Okay, so characterized by heat, pain, redness, and swelling. Then we have the lesion. Okay, lesion or wound. Also, we have the malignant. Okay, when we say metastasize, It is to spread from one part of the body to another. Okay, and metastasize or metastasis is a characteristic of a malignant neoplasia or cancer. Then necrosis means death of tissue. Okay, neoplasm, abnormal uncontrolled growth of tissue. Then we have the phagocytosis, the ingestion of organisms such as invading bacteria or small particles of waste material by a cell or even foreign body, okay, inside our system. Okay, in which uh, they are ingested by the phagocyte and destroyed by the phagocyte. Okay. And the root is phago, phago, meaning to eat. Then we have the parasite, the smallest of the microorganisms. Okay, parasites can only grow or live in a host. Outside the host, it cannot survive. And pathogen, any disease-causing organism. Okay, prolapse, dropping or downward displacement of an organ, or synonymous to ptosis. Then pus, a product of inflammation consisting of fluid and white blood cells with the root pi or payo. Okay, then the sarcoma. Again, sarcoma is the uh, cancer of connective tissues, bones, and muscles. Okay, sarco meaning flesh. Okay, from the Greek word sarco, flesh. Then we have sepsis. Sepsis is the presence of harmful organisms or toxin in the blood, or basically, sepsis is infection of the blood. Then toxin, a poison, and then trauma, a physical or psychological wound or injury. Okay, next we have the words pertaining to the diseases or roots for diseases. We have the combining from algio or algesio, which means pain. Algesia is an example, condition of having pain. Okay. Then carcino, which means cancer or carcinoma, carcinogen substance that produces cancer. Then we have cystocysty, okay, cyst or filled sac or pouch or bladder, cystic, pertaining to the bladder or pertaining to or having cysts. Then we have lith. Lith means calculus or stones. So lithiasis, meaning stone formation. Okay, next we have onco means tumor. Oncogene, gene that causes a tumor. Okay, prefixes of diseases. For diseases, we have brady, meaning slow. Okay, so the example is bradypnea, meaning slow breathing. Then we have the dis, which means abnormal, painful, difficult, dysplasia, abnormal development of tissue. Then we have the mal, prefix mal meaning bad or poor, maladaptive or poorly suited to a specific use or to the environment. Then we have the paki meaning thick, pakemia, pakemia, meaning thickness of the blood. Pachy means thick, emia means blood. Then we have the tachy, meaning rapid. Okay, tachycardia is the example. Tachycardia means rapid heart rate. Okay, tachy and brady are opposites. Next, we have zero, meaning dry, cirrhosis, dryness of the skin or membrane. The suffixes for disease, we have the algia, algesia meaning pain, myalgia meaning pain in the muscle. We have seal, or that means hernia or local dilation. And we have the hydrocele or localized dilatation caused by a fluid or containing fluid. Then we have the classes of um, clasia. Okay, it means breaking. Osteoclasis means breaking of a bone. Then we have the itis. Okay, so inflammation, meningitis or inflammation of the meninges. Okay, next we have the megaly, enlargement. Hepatomegaly is an example, enlargement of the liver. Then we have odynia, meaning pain. So urodinia, okay, meaning pain on urination, udynia. Then oma tumor, so blastoma, tumor of immature cells. Then pathy, meaning any disease. Oh, so cardiopathy is any disease of the heart. Raje or raja, okay, bursting forth profuse flow or hemorrhage. So the example given is hemorrhage, profuse blood flow. Okay, so we should double the R. Okay, when adding this SI suffix to a root word. Same goes with rhea and rhexis. Rhea means flow, discharge. Mucorrhea means discharge or mucus. And rhexis meaning rupture. So the example is aminorhexis or amniorhexis, which means rupture of the amniotic sac. Next is the schisis, fissure splitting. Retinoschisis, splitting of the retina of the eye. Words for disease used as suffix. Okay. We have dilation or dilatation, which means expansion or widening. So the example given is vasodilation, which means widening of the blood vessels. Vaso meaning blood vessels, dilation meaning widening. So vasodilation is the widening of the blood vessels. Then we have the ectasia or ectasis. Okay? Dilation also is the meaning of ectasia or widening. Then we have the example bronchiectasis. Bronchiectasis, okay, meaning chronic dilation of the bronchus. Okay? Bronchus, bronchi. Then edema, accumulation of fluid or swelling. So we have the lymphedema. Lymphedema, swelling of tissue as a result of lymphatic blockage. Lymphedema. Then we have the lysis, separation, loosening, dissolving, destruction. Dialysis, separation of substances by passage through a membrane. Then we have the malacia or malacia, meaning softening. The example is splenomalacia, which means softening of the spleen. Spleno, root word for spleen. Words for disease use a suffix, okay? Continuation. So we have necrosis, okay, meaning death of or osteonecrosis, death of bone tissues. Then ptosis, dropping, downward displacement, or prolapse. The example is blepharoptosis, okay, blepharoptosis, Okay? Meaning drooping or dropping of the eyelid. Blepharo meaning eyelid. Then spasm, sudden contraction or cramp. So bronchospasm meaning spasm of the bronchus. And the opposite of bronchospasm is bronchiectasis, the dilation or dilatation of the bronchi. Okay? Then we have the stasis or suppression or stoppage, such as menostasis, suppression of menstrual flow. Then we have the stenosis, okay? Narrowing or constriction, arteriostenosis, meaning narrowing of an artery. Okay, next we have the table for prefixes and roots for infectious diseases. So we have the prefixes staphylo, meaning grape-like cluster, and strepto, meaning twisted chain or chains. Okay, so staphylococcus, then we have the streptobacillus. Staphylococcus round bacterium that forms a cluster. Then rod-shaped bacterium or bacteria that forms chains is streptobacillus or bacilli. Next, bacilli, okay, meaning bacillus or bacillo. Bacilluria meaning bacilli in the urine. Bacterium meaning bacterium, bacteria. Bactericide, an agent that kills bacteria or with the suffix side meaning kill. Then we have the myco, which means fungus or mold. Mycosis, any disease condition caused by a fungus. And we have the vir or viro, which means virus. Example is viremia, presence of virus in the blood. Next, after discussing diseases and the classification of diseases, now we move to diagnosis. So diagnosis is the determination of the nature and cause of a disease. And this usually begins with the patient's history. And this patient history includes present illness, okay, description of the symptoms, a past medical history, and the um, family and social history, okay, as well as physical examination. So it is important that uh, a review of the physical, or sorry, a review of the history of present illness must be determined in order for the physician to have a correct and accurate diagnosis. And also physical examination is an important step in diagnosis. This includes a review of all systems and observation of the signs of illness that follows the history taking. Okay? So, physical examination involves the use of different paraphernalia or medical devices, such as the stethoscope, okay, uh, blood sphygmomanometer, okay, uh, thermometer, okay, and pen light and others, as well as the use of different uh, techniques. Okay, so these techniques are inspection. Okay, so it is just visual examination. Then palpation, touching the surface with the body of the body with the hands or fingers, such as the palpation the uh, of the radial pulse. Okay, and during the palpation, uh, you should only touch the surface of the body with fingers or hands and no other movement. Just touch only. Then we have percussion, tapping the body and listening to the sounds produced. Okay? Percussion. And lastly, we have auscultation. Okay? Listening to body sounds with the use of a stethoscope. Next, we have vital signs. So vital signs includes temperature. Okay? Temperature, the blood pressure, okay, which is abbreviated to BP, and temperature to just the capital letter T. Then we have the pulse rate or PR and the respiratory rate. So these are the vital signs. Vital signs have the abbreviation VS, and it is important to the practice that we should know how to perform or how to take vital signs. Okay, so now we move to the different imaging techniques. So we have the cine radiography. Okay, cine means moving or motion picture. Okay, so radiography, okay, is the process of making images by use of radiation. Then we have the computed tomography, CT or CT scan. Use of computer-generated images for a large number of X-ray passed to different angles through the body, which produces a three-dimensional picture of a cross-sectional body. Then we have the fluoroscopy. Okay? Use of X-ray to examine structures. The shadow cast by the X-ray passed through the body are observed through a fluorescent, fluorescent screen, and the device is called fluoroscope. Then we have the magnetic resonance imaging or MRI. It is production of image through the use of magnetic field and radio frequency waves. Then we have the positron emission tomography or PET. Okay, so it is the production of cross-sectional images by administration of a natural substance such as glucose or labeled with a positron emitting isotope, or basically a radioactive material. Then radiography, use of X-ray pass through the body to make a visible record of the internal structures. Then scintigraphy, motion, production of images of the distribution of radioactivity in tissue. Then ultrasonography, okay, use of echoes of high frequency sound waves traveling back from different tissue to view the internal organs of the body. Okay. Okay, now we have roots for physical forces. Aero, air, gas, aerobic, baro, pressure, barotrauma, chromo, chromato, color or stain, chrono means time, cryo means cold, electro, electricity, ergo work, phono, sound, photo, light, radio, radiation, sono, sound, thermo, heat, or temperature. Next, suffixes for diagnosis. Graph, meaning instrument for recording. So polygraph is the lie detector machine. Poly means many. So instrument used for many recordings. Next, we have graphy, an act of recording data. And gram, a record of data. So those three are different. Okay, when we say graph, it is the instrument used for recording. When we say graphy, it is the act of recording. Then we have gram, a record of the data. So we have radiograph, which is the polygraph, which is the machine, the instrument. Okay, we have the radiography, which is the act of obtaining pictures using X-ray. Then we have the gram, sonogram, record obtained by using ultrasound. Then meter, instrument for measuring. So example, audiometer, instrument for measuring hearing. Okay, we have the uh, metry. Metry means measurement of. So ergometry, measurement of work done. Okay. Then we have the scope, instrument for viewing or examination. Then scopy, which means examination of. Okay. So the example is endoscope, viewing instrument for the inside of an organ or cavity. Then laparoscopy, examination of the abdomen through the abdominal wall. Then we have suffixes for surgery. We have synthesis, asynthesis, puncture or tap, thoracentesis, puncture or tap of the chest or thorax. Then we have the desis, binding, fusion, pleurodesis, binding of the pleural membranes. Ectomy, excision or surgical removal. Hysterectomy means excision or surgical removal of the uterus. Hystero means uterus. Then pexy, surgical fixation. Cystopexy means surgical fixation of the bladder. Then plastic repair, plastic surgery or reconstruction. We have rhinoplasty, plastic surgery of the nose. Then raphy, surgical repair or suture. Herniorrhaphy, surgical repair of the hernia. Then stomy. Stomy means surgical creation of an opening. So colostomy, creation of an opening into the colon, colostomy. Ostomy. Tome or tome means instrument for incision. So microtome, instrument for cutting thin sections of tissue for microscopic study. Then we have the tomy, incision or cutting. Tracheotomy, surgical incision of the trachea. Then tripsy, crushing. Example is lithotripsy, crushing of stones. Okay, and the following are symbols used in the clinical practice. We have the one with the degree, symbol of degree, which is primary. Then the number two with the symbol of degree is secondary to. Okay, like fracture, secondary to fall. Nagka-fracture siya dahil siya ay nahulog. Okay, the Greek letter delta means change. Then capital letters L and R means left and right. Okay, means left and means right, respectively. And then the arrow up, arrow down means increase or decrease, respectively. And then the symbol degree means degree, and then the symbol greater than, less than, and then the symbol of number or pound. Okay, so yan yung mga common symbols na ginagamit. So there are still other symbols that we are using, especially in radiography, that we will be discussing in the following lessons. Okay, so that's all for module 2. So thank you for listening, and goodbye and thank you. Okay.